Good afternoon, everybody. Thank you, Sue, for that introduction. My name is Juan Reynoso, as Sue mentioned, and I'm a practicing emergency physician. First of all, I want to say thank you for the invitation of having us here. What I've learned is that the city of Santa Maria has approximately 107 citizens. And of the 107,000, of the 107,000 citizens, approximately 75% identify with the Hispanic or Latinx self-identification. And out of the entire population, it's approximately 65% that speak a language other than English as their primary language at home. This is how they communicate. This is how they build trust. It's by understanding each other. And of those 107,000, Spanish comprises the majority, with 60% of that. Okay, so now let's bring it home. Well, COVID taught us a lot. Yes, we did lose some. We lost many more lives than we would like. And with something that a lot of people don't know, we do so every year to the flu, but we didn't garner enough attention or as much attention to it because this was novel, completely new. But we capitalized on this opportunity to learn. And that is true here in Santa Maria as well. Right in the middle of the pandemic, Trebid's group joined us at Marian, where we started to have Mixteco language interpretive services in the emergency department, in the critical care unit, and in labor and delivery. So that was a major resource to our providers and our physicians in order to provide real-time decision-making assessments and interventions to our patients. As you can imagine, during COVID, through the thick of it, we had to make decisions in the moment. Do we go in this direction or in a separate direction? We need to honor the wishes of the family and the patient themselves. But without being able to directly communicate with them, we didn't afford that luxury of time. So having Trebid's team to be able to assist us right in the moment was critically important to us. Not only from a satisfaction to our physicians, but to the patients and their families. Can you imagine the level of trust that they had for us right there in the moment that we said, hey, this is critical. We're all in it together. We have support that's going to allow us to communicate with you and you with us in order for us to deliver the best care that we can provide to you. And that's where we are. That's what we learned. We learned that by bringing these services, we're able to build those bridges of trust to the patients and their families. As Marian becomes an increasingly more complex healthcare environment, as a member of the medical community, that's very exciting. We are transitioning from a level 3 to a level 2 trauma center, the level of critical care with now the ECMO device that we have and equipment in Santa Maria. That is, it's super exciting to us from a scientific standpoint, the future of pediatric care in Santa Maria. So as we continue to elevate the care of trauma, stroke, cardiac care, pediatric care, women's health care, we will continuously rely and need this resource of being able to communicate with our patients. So for us, it's a very exciting times in terms of how do we do this? What best way to do this? So we have a vision and we have a plan. So I wanted to go over this vision. We took stock of what we've learned, so now we know what we need. We took stock of what we have, so we looked at our resources. We went back to our communities. Many of us got together, including Dr. Gonzalez, who's here in the audience, and our medical director of the emergency department. And we said, okay, wait a second. We have this population. We have high school students who have a dream and who have a wish to receive some kind of guidance, some kind of mentorship, not just in case they're interested in healthcare, but just for any profession, for any future. And then we have us. Why don't we connect those dots? We have college students locally who have similar dreams and need similar guidance. And yes, they receive the professional counselors' guidance from their colleges, but there's nothing like making that personal connection and that lifelong relationship and commitment to them. So we want to tap into that resource and connect that dot to the need in our community, to the need in our hospital. We want it to be homegrown with the resources that we already have. We believe by doing that, it would be a much richer program, a lot more consistent and reproducible year after year, because we know we will always have the youth to tap into. We will always have high schoolers. We will always have the college students here. So why not tap into that resource and create the bridge? More importantly, create the bridge to grow a program in the future to develop futures directly homegrown from their own community. That is how we build the trust. That is how we deliver excellent care. And so with that, I conclude my message, which is not standing alone. I want to invite Trebid to complement some of the information that I've provided and to share what else did we learn from the pandemic through the services that her team has brought to our healthcare environment.
Thank you, everyone. Hi, how are you? My name is Gilbert. My maiden name is Sanchez Morales. And growing up, I think it was easier because people would say, oh, Sanchez Morales, you're Hispanic. But then when I got married, I had this dilemma of, should I change my last name? If I change it, I don't want to make my mom mad or my dad upset. You know, it's a big deal. And so it took me 3 years, and I finally was like, you know what? Let me confuse people even more. And so let me change it to Gilbert. And then people were really confused. They were like, what are you? So I was raised and I was born here in Santa Maria. I was raised here. I've lived here all my life. Both of my parents immigrated from the southern state of Oaxaca, Mexico. Both of my parents speak Mixteco. For various and multiple reasons, they chose not to teach me Mixteco. And I think that it was primarily because I was already struggling with learning English, and so they just spoke to me in Spanish. And they bicker and argue in Mixteco, and we knew, okay, let's get out of here because this is bad. And so I never really learned Mixteco. But I think feeling the helplessness of not being able to understand and wanting to help really created this it planted a little seed that never left. I always wanted to help. And I didn't know because we didn't have, I didn't grow up having mentors. All of my family worked in the fields. My uncles, my aunts, they still work in ag. They picked everything from, cucumber, tomate, strawberries, grapes, everything you can think of here on the Central Coast, they picked it. And my grandpa just retired not too long ago. He's in his 70s now, and you can see the toll that it takes on your body. But one of the biggest things that they always pushed for was education. Go to school, échale ganas, you can do this. And as first generation, that's really hard to go and to kind of, navigate these systems. But at a very young age, I became also an interpreter for my family. From the grocery store to the pediatrician's office, to the DMV. And so I remember my mom telling me, ve y pregúntale a la señora si ocupo esto. And I would turn around and I'd plead with her, like, please don't make me do this. And so then she'd say, ve y haz lo que te estoy diciendo. And so that's no longer a request, that's an order. So I'm like turning around and I'm like, my mom wants to know if, And so that was my whole life. And at a very young age, I really learned the importance of navigating 2 languages and being able to access resources. Because if you knew how to speak English, you would be able to understand and gain that knowledge. And so that was something that, that experience taught me at a very young age. And so I carried that all my life. And with mentorship, and I don't think a lot of my colleagues know this, but I grew up at Marian. I started doing, when I was 14, I did the volunteering program. Up until I turned 18, went to college, came back, did my internship, and then I got a job there. And so I was pretty good at math and science. and that's, so I know a lot of people there. I really do feel like that's part of me. That's my home. That's a facility. I remember the old hospital, and I remember the ER. And so I've grown there. I've grown with it and with my community. And just echoing what Dr. Reynoso said earlier, the pandemic taught us a lot of things, and a lot of us lost, and a lot of us grieved. But I think the most important thing that it taught us is that we really do need bilingual interpreters or bilingual medical staff in the hospital. Some groups were more effective than others, and we saw that with our Spanish-speaking, our Mixteco-speaking community, and so we want to learn from that, and we want to do better. And we have the resources, we have the youth, we have the people that want to do it, and so why not? And if in 5 years from now they want to go off and be nurses, be doctors, be respiratory therapists, why not? And that's my dream. That's something that I want to see in my community because I love this community with all my heart. I know that you all are so generous and have been so generous with your time already. You are here today when you could be doing anything else, but you're here listening to our message. And I just come with all the love that I have for my community, and on behalf of my Spanish-speaking community, I just ask that you support and that you dream with us, because I think that this is possible. I've seen it with our Mixteco interpreters, and I think we can do it again. And so, you know what? What a better way. I know some of you guys employ farm workers, and what a better way than to honor them and their work through their children by creating opportunities for their children. And so I just appreciate your time, and I'm happy to answer any questions, and just thank you so much for being here today.
Yeah. I can't not. Sorry. So I just want to I'm again the medical director of the ER. Hi. And so I want to sort of paint a picture of exactly what it is that we're asking, because there are sort of two separate pieces of this. Trebid's group has, as we've all mentioned, been like a ridiculously incredible resource for us. And we know, looking at the data from the pandemic, that it hit people of color much harder than it did white people. That's just what happened. And if we had not had the resource of them, I think we're at 24/7 now, are we? Just shy? We're so close to 24/7 in-person Mixteco. If we had not had that, I can't imagine what we would have done. When somebody comes in, we need to know, like Dr. Reynoso was saying, are we going to intubate you or not? Is this a thing where we're going to kind of accept death and talk about it or not? Like, I can't imagine what it would have been like trying to wait a half an hour to find an iPad person who happens to speak Mixteco to have this conversation with us and with this family. It would have been just impossible. And so looking at the timing, you're right. How could you not have stepped in? And it couldn't have been more perfect. We're so lucky. And so our need in the Mixteco area, Trebid's group is meeting incredibly. They're not just a language translation service, they're an advocacy service, right? There are no written materials in Mixteco. And so we now have people calling from clinics like, hey, I'm at my PCP, help me. Like, they don't understand anything I'm saying. And so what she's doing is sort of more full spectrum, necessary, incredible work, educational services, et cetera. And we started to team up on that. So it's amazing. But in Spanish, we still really have a massive gap. We're trying to use the iPad services. The administration has done as much as they possibly can to help us in the meantime. But we're realizing, because of the pandemic, a much more pressing need. And that watching the success of that program, we want an in-person Spanish translator as well, specifically for now in the ER. We are the front door, the back door, the side door, the roof of the hospital. And we know that we are. And it's someday we'd love to have 24/7 coverage to the whole hospital, but for right now, our focus altogether is acute care. How do we take people when they're most vulnerable and have someone walk in who looks like you, who speaks like you? And so we want to blow that up. I don't just want to hire translators. We want to go out to the farm workers and say, do you have a kid who's in high school who speaks English and Spanish? Do you have a kid who's in junior college, at Allen Hancock, and wants to come and work for us? And we want to pay them. And we want to teach them, we want to mentor them. We want to work on health literacy and teaching these children things about asthma and blood pressure and diabetes, and watch that leak back into these communities where right now they don't know those things. And so it would be more than employment, but we do think that fiscal piece of it is important. That's one of the health disparities in our area, right? Is that a lot of our immigrant Latino families don't have the same opportunities as the white families here. They just don't. And so that's our dream, is to continue investing what Trebid's doing until we get to that full 24/7 Mixteco. But simultaneously, the time is now. And how do we get those Spanish translation services and really work on addressing the public health of our whole community? Because that's our job at Marian. If we're really a regional medical center and we're going to be a powerhouse here and build that trust, we have to do more than just hire people to translate in the ER. So that's the dream. That's what we're actually trying to accomplish.